Superior humerus, we do a motion, please. Go ahead and line your back. So we've got a superior humerus, and this is particularly valuable for patients with impingement syndromes. So for a superior humerus. And now, are you guys cool with just keep going through rather than taking a break? I'm cool with that if you are. Okay. So we're going to bring the arm into 90 degrees abduction. And got to make sure your contact is accurate. We will check to see if you contact the acromion, you'll lose points. You have to be distal to the acromion on the humeral head. I'm going to take a thumb web contact with a P to A tissue clip. And so I'm starting from P to come from P to A so I can feel my wrist is neutral. I don't want to be like this. You won't be practicing for very long if you're thrusted in this position. I want to be like this. I want to have my wrist in a neutral position, and then I simply stress and thrust from wrist to eye.
Do you have to check for inferior?
Yeah, well, you should know that. You don't have to do it when you're demonstrating this, but we might ask you, what would be a contraindication for that? Okay? Constant trouble, aren't you? Okay. Feel good?
And you said the contact was where for that one?
The humeral head and just distal to the acromion. That's very important, distal to the acromion. So that was for someone fixated in horizontal abduction. Now we have fixations in flexion. So we're at 90 degrees flexion, and I can do this in two different positions. I could have the arm on the opposite shoulder. That's going to internally rotate, stretching the posterior capsule more. I'm going to have the hand behind the neck. That's going to externally rotate, stretching the anterior capsule more. And it's up to you to choose which of these you do. Now I'm going to interlace my fingers so that my pinky is just distal to the acromion. So you've got to find the acromion. They're going to be just distal to that. Interlace my fingers. Again, for a woman, she can cover her breast. I have my shoulder to his elbow to keep him at 90 degrees. I don't want it higher, just at 90 degrees. Then simply stress and thrust from S to I. Let me ask you to sit up next. And just at the end of the table facing this way. That's good. And again, any one of these cases, you know, we do not ever place our legs between our patient's legs, so be careful of doing that. And so now we're going to have you same position, either here or here. And I'm going to take a nice broad scissor stance, come nice and low. Place the elbow on my shoulder, interlace my fingers, just distal to the acromion, let your arm completely relax, that's good. And then I stress and thrust from next time. Any questions? Did you get to see that okay?
Yeah. Can you do it again on this side so I can see the contact?
So are you going to make a file and share it with everybody?
Yes, sir.
Is it going to be like one big video?
Yeah. Well, it'll be 2 videos. I broke it up in half.
Can you send me copies?
Sure.
Okay. So now, same kind of thing, 90 degrees flexion, interlace my fingers, let your shoulders just fall, that's good. Again, it's sometimes helpful to have them in a chair so that they're more relaxed. You can relax back against the chair, and then just drop down. Okay, you don't want the arm above 90 degrees, just add 90 degrees. Yeah, superior humerus adjustments for impingement syndrome, and of course inferior instability is a contraindication.
You have on the abduction one that you have supine thigh contact?
Ignore that.
Okay.
You can cross that. So we go anterior humerus. Go ahead and line your back here. So we did anterior humerus in different positions as well. Wherever it's fixated, that's where we adjust it. And so now at 90 degrees abduction, of course we test first for posterior instability, so if the arm's falling right there. I'm going to broad contact on the humeral head, and just scoot a teeny bit towards the that's right. So I want the scapula on the table and the humerus off the table. Then I simply stress and thrust from A to B. Know that they don't have posterior instability. And just as a side note, and this can be kind of helpful, is that you can also vary the force. I can vary his position by having different degrees of horizontal adduction, keeping my forearm perpendicular to his humerus. And so now I'm actually going more lateral than anterior. And I won't test you on that, but that's a nice variety that helps when you actually treat people. And we also do an anterior humerus at 90 degrees flexion. And like, as with other situations, when we're at 90 degrees flexion, I can have the hand on the opposite shoulder, causing more internal rotation, or have the hand behind the neck, causing more external rotation. And important for this one, we need to have the elbow midline. And so that my direction of force is not just A to P, but it's also medial to lateral because of the shape of the glenoid. Remember, the glenoid faces anterior. Now, when I slide along the side of the glenoid, if I just thrust A to P, I tend to just jam the joint. So you have the humerus a little bit medial. I'm going to stabilize the scapula, as we've done before. Nice broad contact with my hand so that the spine of the scapula is between the index and the chiropractic index finger. How do I find the spine of the scapula? It's the only bony thing back there. Just reach back there and you feel something bony. That's the spine of the scapula. Hand on the elbow, I have him medial. It's at 90 degrees flexion. And I simply do a body drop, stress and thrust from A to P and medial to lateral. Have you come on and sit up? Again, when you're doing the seated adjustments, you want them back on the table all the way so that it's easier for you. That's all about being for you. And now I'm going to use my sternum to stabilize the spine of the scapula. And again, you can have the hand in either position. Sternum to the spine of the scapula, keeping the elbow midline. That's important. And I stress and thrust from A to P and medial to lateral. And for women, again, you need to be comfortable and you need your patients to come back to the office for the right reasons. I'm told if you use the top of your sternum, you won't be putting your breasts against them and then have them, you know, wanting you to Twitter them.
Oh.
Anthony Weiner, right? The reason he did that is he was just trying to help people understand how to say his name, right? You know? So again, you can do it in this position with the hand behind the neck, and this is where you want to be a little careful, make it fits for me. Try not to hit yourself in the jaw. Good. Good. Okay, let's have somebody else. Thank you. Would you be my next?
Which one was that one?
Posterior humerus.
Oh, okay.
Posterior humerus.